Hi, I'm Grace Girk, former emergency room nurse turned physician associate and mom to 5 active boys, equipping moms with tools for wholehearted living. Welcome to Skills for Moms. Hi, Misty. Welcome to the Skills for Moms podcast. We're so
Hi,
glad
I'm
to
so
hear.
glad to be here.
Oh, thank you for coming on the show.
Yes, it's very exciting to be able to speak about all of the things myofunctional therapy.
Yeah, well, I just want to give our audience a little introduction to you. So, Misty, who's our personal therapist for 2 of our children, she has 30 years of experience in the dental field and also a background in dental hygiene. You're passionate about helping your patients live healthier lives. You're the only therapist in East Texas who is certified by the International Association for Orofacial Myology, and you treat a variety of dysfunctions, including tongue and lip ties, thumb sucking, nail biting, tongue thrust, TMJ, open mouth issues, you name it. You also help people with breathing issues, also functional nutrition. Misty also has her certified functional nutritional counselor certification and then her functional nutrition lifestyle practitioner certification. So you are so well qualified. You also have your own business, East Texas Orofacial Myology, where you see patients in person and virtually. And you came highly recommended by pretty much every top dentist and orthodontist we consulted in the DFW Metroplex. So we're so glad to be connected with you personally, Misty.
Well, likewise, very flattering that that you trust me. I appreciate that to take a part in your children's growth and development. So it means a lot to me that you place your trust in me. So thank you.
Aw. Yeah, I would love to hear more, just a little bit about your background beyond the professional side. Like, what gave you this passion for this area and why do you care about it? Something that many of us don't even know exists.
Exactly. Well, like most of us, if we fall into something, we have a personal experience.
Mm-hmm.
And I look back on my journey and being adopted, never having the opportunity to breastfeed,
Mm-hmm.
really kind of set the stage for my oral development. And from what I can recall, I was on the bottle too long.
Mm-hmm.
So that kind of set me up for some malocclusion and so I have a pretty long journey of just a personal history with
Yeah.
orthodontics and jaw surgery,
Mm-hmm.
and then a second round of orthodontics, and also with my child. So
Mm-hmm.
he, looking back, I didn't know the things that I know now. I mean, he's grown now, so I can put all of the pieces together to understand why we struggled so
Yeah.
much. So, yes, it's very personal. And when I took my first course in understanding what these disorders were, I was still working in the dental office,
Mm-hmm.
and it was like the light was just it went on. I cannot go back to the dental office
Yeah.
and see patients the way I used to. There is a reason behind the dysfunction.
Yeah.
And so that's how my journey began.
Wow. Wow. Well, I can really relate, personally. I went through jaw surgery. I had 2 rounds of braces. I was told I always mouth breathed and, no one knew what to do with that, and now looking back of seeing the full picture and seeing it in my kids of like, wow, I just needed some help and retraining that back then in the 90s, I don't think was out there or very few people knew what was lacking, I guess.
Yes.
I've heard so many of these big words recently that I'm trying to dive into myself: myofunctional, craniosacral, myofascial, and sometimes they all just blend together. So, could you just define in a simple way what is myofunctional therapy?
Yes, and that is so common because they do overlap. So I would say defining myofunctional therapy is working with all of the muscles that we use to breathe, eat, speak, chew, and swallow with in the oral phase of the swallow, which also includes oral habit elimination. So that's where thumb sucking, long term pacifier use, and nail biting, and all of those habits come into play. So it's retraining a, a neuromuscular pathway, because a lot of times these children or adults, they have an incorrect swallow pattern. So we need to correct that. And so we have to find the reason why the dysfunction is there to begin with.
Hmm.
And cranial sacral therapy is wonderful if we can incorporate that. I don't do that personally,
Hmm.
but it is more of a very gentle, light touch to really reset the nervous system. And that can be very beneficial when, especially with babies, when they are having some oral dysfunction and feeding issues. But also, it is beneficial for adults too. So, the myofunctional therapy is more hands on,
Hmm.
um, exercise based, active, and whereas the cranial sacral therapy is very gentle,
Hmm.
a non exercise approach.
Yeah, that makes a lot of sense. I mean, makes me think of, in the traditional medical world, you have, physical therapy, you need to maybe strengthen or retrain something after an injury or surgery, but then you also might need massage or something to support the training that you're doing. Um,
Exactly.
yeah, yeah, that makes a lot of sense. And you take care of both children and adults, is that right?
Yes. Usually, when a child is ready for myofunctional therapy, I like for them to be able to do an exercise. If I ask them to do something, to really kind of understand
Mhm.
and have, they be able to volitionally do what or mock what I'm doing or what mom is doing and just really kind of set them up. And then the older that they get, we can build on that and become a little bit more advanced. But
Mhm.
sometimes we start in stages,
Mhm.
a 3 or 4 year old is not going to have the same program that a 6 or 7 year old may.
Yeah, that makes a lot
Yeah.
of sense.
Hmm.
Because I know as a mom, if you start seeing an issue with a young child, maybe even a toddler, where I'm thinking about like the white diet, where I don't know what happened, but now we're dealing with this with one of my children. He's 2, of like, he was eating more food and now he just wants chicken nuggets and pasta. What happened, or what did we do wrong? What would be your advice for a mom who's maybe in between, she there's the baby stage, but then there's the, 3 plus where you could benefit from therapy. What does a mom kind of in the middle time do?
I think if we can find a way to make sure that they are able to chew
Mhm.
correctly and try to get away from any of the pouched foods or softer foods,
Mhm.
because sometimes those children, when they become picky, they're gravitating towards more processed
Yeah.
or softer foods. And
Mhm.
if we can encourage more chewing, that's really going to help to develop the jaws because muscle always influences bone growth.
Mhm.
And but sometimes, kids, they just kind of go through a little phase and maybe they're out of it. But we have so many different avenues. If it's true feeding, we can refer to a feeding specialist.
Mhm.
If it is a functional problem with maybe the tongue just can't gather and lateralize the food appropriately, maybe they come a little aversive to certain
Yeah.
textures. So sometimes it's maybe a phase, and then sometimes it needs to be looked into a little bit further.
Yeah, so it sounds like some things a young mom could do, really thinking about chewing with the kid, not having pacifiers. Do you have certain limits on where, I know even pediatricians will say after one, don't do a bottle anymore and things like that. But then it's almost like as long as you don't do those two things or you don't suck the thumb, you can kind of think, oh, I guess my kid's fine. But I guess for me and with my kids on our journey, it feels like just doing those things alone, no bottle at one, no passy, or no thumb sucking, you could still have, dysfunction. So, do you have any good takeaways or things a mom could do right now, who has a young, maybe toddler?
Yes, I would say the most important thing is getting the tongue in the palate because that is going to guide the jaw to grow forward and out, which is also going to support the airway
Mhm.
and increase the nasal space. So if you're noticing that your child is mouth breathing, and I don't mean necessarily really wide open mouth like we would think mouth breathing, like
Mhm.
Napoleon Dynamite
Yeah.
type mouth breathing, but even just a very slight open posture in the lips
Mm.
can signify that the tongue is low.
Yeah.
And, it's hard because we're looking at our children every day,
Mhm.
and what we sometimes see as normal, it may be a dysfunction and we're not recognizing it because they've always done that.
Yeah.
And who's teaching us these things?
Mhm.
Nobody. I never learned all of these
Yeah.
things to look for. So I would say if the tongue is not able to lift in the palate, and that's kind of complicated too because some kids they just need a few exercises. They need a few weeks to really work on
Mhm.
getting the tongue to the palate. So if we just really focus on looking at kind of the red flags and how is their sleep? Are they restless? Um, One early clue for toddlers and babies is recurrent ear infections.
Mm.
So, in looking at the early feeding history, because if
Yeah.
maybe they struggled with the latch, or
Mhm.
maybe mom was told, oh, here's a nipple shield. And okay, well, why does she
Why
need
do
that? There's a problem, there's a dysfunction or breakdown there. So, having a good suck swallow dyad is so beneficial for the eustachian tubes.
Mhm.
And so those are a lot of the red flags that I look for when I'm doing the medical history
Yeah.
and, maybe having tubes placed and just
Mhm.
chronic upper respiratory infections because they're not able to use the nose and warm and humidify and filter. And, all of that is like a domino effect with the
Yeah.
adenoids flaring up. And,
Mhm.
I know you're aware of that with your background and
Yeah.
seeing that with in working with the ENTs and, the tonsillar tissue. And we really need the lip closure for so many things, including the nitric oxide that's so healing to our body.
Yeah. Yeah, that reminds me of, I think you have it in your office, James Nestor, his book Breathe, as a
Yes.
good starting book of if you've never even considered why, mouth breathing may not be beneficial, or like you're saying, maybe it's not a super obvious mouth breathing like Napoleon Dynamite, but it's just a subtle thing. And then all of a sudden, the whole, if you're not using it, you lose it. Like we learned in my ENT training, when a patient has a tracheostomy, a hole to breathe for a medical
Mhm.
reason in their neck, after I think it's only a few weeks, their nose completely occludes, not because it's nothing's
Oh,
wrong with it, but just that's the body. The body can only breathe through here. And so there's no reason for the body to keep the nose patent.
right.
Um, so yeah, that's a really good, I don't know, feels like an aha that we don't talk about enough, the nasal
Right.
breathing. Yeah.
And I try to tell my kids, I try to make everything fun and it's like, okay, let's think about what our nose is used for. And I have them tell me, smelling, breathing. And it's okay, well, so what do we do with our mouth? And then, try to get them to talk about, all the
Yes.
things. And then like, okay, so let's think about this. We breathe through our nose and we eat with our mouth. we
Mhm.
don't eat with our nose and breathe through our
Yeah.
mouth. So trying to get on their level
Yeah.
to have them more aware.
Mhm.
And so that's a little tricky too. So I think moms can just start observing their child when they're unaware, when they are asleep
Mhm.
um, at night, but also in the car seat or when they're on the couch watching a movie or when you're reading with them.
Mhm.
Just really taking a look at their jaw posture. And if it's low, their tongue is most likely low.
Mhm. And
Yeah.
then for a mom who she realizes that, what does she do from there? How does a mom know, okay, I just need to kind of try to do nasal saline, try to help my child, keep their tongue on the top of their mouth versus I need some extra help from someone like you.
Right. Well, one of the things that I love is just making sure that the child knows how to blow their nose. We
Mhm.
do a lot of nasal hygiene in here, and I'm kind of surprised at some of the kids that are a little bit older that actually really cannot clean their nose well.
Mm,
And maybe they're fearful of nasal sprays. So I always say if they don't like the spray, then use the infant drop and drop that in their nose, even if they're older.
yeah.
And I really love the X Clear, the XLEAR brand.
Uh-huh. Yeah.
And that is so helpful in resolving inflammatory issues and all of the things. So if that is not working and mom has been to, her primary care physician or ENT, someone, an airway specialist to take a look and they've ruled out, airway obstruction, then I would say I like to work with just having them think about their food choices
Mhm.
and maybe incorporate something that they really have to chew a little bit more. And if a child is still aversive to trying a new food, then maybe we do more chewy tubes or,
Mhm.
and those are pretty easy to come by, around $10.
Yeah.
And, just have the child really chewing and really working those muscles of mastication. And
Mhm.
then hopefully that will encourage them to, feel better about grabbing for something like a raw carrot or an apple.
Yeah.
But, just working, having all of the muscles working together, the facial muscles, the lips, and the tongue. But if it's prolonging for an extended period of time, then I would say it would be important to have someone do an oral evaluation and look for tongue range of motion. Look at the airway. A lot of times it is the airway. These kids are afraid to swallow because they're afraid they're going to choke.
Mm.
So just making sure their palate is wide and it's being supportive for the swallowing phase.
Okay. Yeah, that makes a lot of sense. And I mean, it's something I feel like right now, personally, we're working through in our home of, you know, we mentioned when we were seeing you last, I think one of our kids was kind of chewing on his shirt, and you had recommended, well, he could get a, safe silicone, kind of like a chew toy that he could use temporarily to kind of nix that habit. And then you're chewing on something hard that gives that, stimulation that he needs. So then we're not doing this bad habit. And I think I've just seen how quickly these bad habits can develop, and it's hard to kind of catch it early on. Like with one of my kids, he had two bouts of adenoiditis, and it basically blocked his nose. But because of that, it caused even more inflammation. Then his tonsils swelled up, and then he ended up needing his tonsils out because he really couldn't breathe at night. And it was kind of past the point of just doing therapy to get better. But I still look back on that and I'm like, man, it just felt like a big snowball of like one thing's happening and then picky eating, and sometimes it could be hard to just notice it when it's small, I guess, or with babies, like, you know, how can we, besides not doing the pouches, how can we with a baby help develop that strong jaw so they want to eat harder foods when they're able to? My baby's about to turn 6 months tomorrow, so that's on my mind as well. Um, Anything to speak into on that?
Well, I don't really work with the babies, but I
Yeah.
will, kind of help advise and guide moms. So, in our culture, we may be a little quick sometimes, and it may not be by choice, it may be out of necessity to not breastfeed for longer.
Mm.
Um, you know, it's something that is very helpful and supportive. And then maybe getting into, like you were saying, the little chewy tubes. I really love utilizing the Myology.
Hmm.
But I also have another little tool that if moms can't afford a Myology right off the bat, there's a little tool. It's the well, I have it here. It's this, and they keep changing the name, but this little brilliant, it looks like a half little munchie, and it's $5. And,
Yes.
that's really a great tool for
Hmm.
the toddler age, that is supportive for chewing, because a lot of times they're sensory seeking.
Hmm.
And if the tongue isn't reaching on the palate right behind the front teeth, where we need it to rest, a lot of times they start to chew on things or become very,
Yes.
oral, and we early on, that's great for the oral development, and the child needs that. But then when it's chronic, like
Yeah.
if you see infants or toddlers that just are hand to the mouth all the time, and their lip stays rolled out and their lips are apart,
Hmm.
as they age, they may continue with that oral posture, and at 4, they still have the same mouth shape and jaw shape as they did when they were a baby with their hand in their mouth.
Mm. Yeah.
Um,
So, like, when we get to that age where I think, because we have myo munchies for our family and have really been trying to implement those, doing time where it's just a little kind of retainer that you chew on and then you can keep in your mouth to keep your lips closed and nasal breathe. But being like, okay, instead of giving my 6 month old his pacifier, we took that away. Now you can chew on this little safe chew toy. I mean, that's kind of a small thing we've done different than with our last child, of like, let's get rid of the pacifier sooner and give them kind of a better alternative that's going to help gear our baby for chewing food as he's getting older. Um, so, yeah, I love that there's like a continuum, because, like you said, it feels like it can be expensive, if you have a lot of kids and you haven't bought in. Why would I buy a $90, shoe thing, but maybe starting small and working up.
yes. And another thing too is, I want to point out that there's a time and place for a pacifier. We know that there's research that
Mm.
is supportive for SIDS.
Yes.
And I always want to ask if there's a continued pacifier habit. I mean, a lot of times we think continued pacifier habit might be, you know, 1, 2.
Mhm.
I've had children that are, preteen, that
Wow.
still have the pacifier. 12-year-olds.
Wow.
And as soon as they, leave school, they have to have the pacifier.
Wow.
And so my goal is to let's find out why. Why is the need? Is the need they can't get the tongue to the palate for that sensory input that they need? Is it trying to move the tongue out of the airway space? Is it trying to open the airway? So I think I don't want moms to think, oh, I should never have given my child a
Yeah.
pacifier. But we just know that long term, it creates a lot more sucking in the front part, and we really need to work more chewing posteriorly and working our muscles. And that is going to help with the oral phase of the
Yeah.
swallow.
Um, yeah, that makes a lot of sense too. And it kind of ties right in with tongue ties. I wanted to touch on that as well. Because my understanding is if a person can't naturally keep their entire tongue on their palate, you're going to have a sensitive gag reflex. You're going to, um, not be tolerant to foods and things touching the back of your mouth because you haven't been used to that sensation from the tongue. And so I know tongue tie can be kind of a big topic of a lot,
Yes.
if you, mommy blogs or Facebook, it's, so much talk about both in infancy, but I think also as kids are getting older, do I need to get some sort of release to help my child speak better or like you're saying, eat better? So I don't know, could you just start to touch a little bit more on where to go with that?
Yes, it is such a hot topic. And, thankfully, we have more and more research to support recognizing and how to treat tongue ties. I would say where a lot of misconception can come from a tongue tie is moms will say, I think my child has a tongue tie.
Mhm,
Maybe we just get that corrected and that's going to fix everything. Or I even have that same issue with adults.
mhm.
They just want to correct the tongue tie, but it really affects the whole body from head to
Yeah,
toe.
yeah.
And I would say if some of the warning signs that I always, or red flags, I should say, that I look for in my evaluation would be a lot of the picky eating. And then we're very specific on how we can measure function and
Mhm,
range of motion of the tongue now, from the tip of the tongue to the middle part of the tongue.
mhm,
And so thankfully we can look at that, and then we can look at the compensatory patterns um, during movement, whether it's jaw movement, speaking, chewing and swallowing, because a lot of times if there's any tethering, then there's definitely compensations, either a forward, what we used to call a tongue thrust, or lisping, things like that, that you could maybe visibly see the tongue being forward, but maybe these are the kids that struggle. Maybe they're messy eating. Maybe they swallow a lot of air. Maybe they, they just are selective on certain food groups. But looking at how they can do all of the shapes with their tongue is important to really dive into the function, and then we can send to a tongue tie release provider that understands the function, and then we can proceed from there. But it's just having a release is not correcting the problem, because
mhm.
if you've been tethered for however many years,
Yeah.
you've created one pattern that you could only do. And then having the release, we have to learn a whole new pattern.
Mhm,
So, really, after the release, then we go through, just making sure that it doesn't, get tight, and we go through the aftercare management. But
mhm.
after that is healed, then we really need to start working on forming new patterns and habituating those. So it can be a little bit overwhelming because it's not just a quick fix. But having the right team that understands the function, it's easier to go through that and not have to do that again later.
Yeah, so really it has to be, I mean, similar to, I would say, other people, if you get a surgery, people think, "Oh, I got my ACL repaired or something," and then they just think, "Oh, everything's great." But the reality is a surgery doesn't just, or you get your gallbladder out for gallstones, but that doesn't deal with the reason you got gallstones to begin with or why the ACL got torn, and so you have to have that therapy and support to really learn how to keep your tongue in a whole new place and learn those new patterns. Yeah, that makes sense. Yeah, I know when my mom, it was kind of a fringe thing, but when I was getting ready to possibly get jaw surgery in high school, there was this tongue therapist in town. And so I started going to this tongue therapist. Here I'm like a teenager to like learn the tongue on the spot and doing all these different tongue exercises. And I think the hope was like, well, maybe that will just, make her jaw be the right size and not have
Mhm.
the open bite now. And I think at that point it was probably a little bit too late, but the things I learned have still stuck with me, of like waking up in the middle of the night and being like, is my tongue up, and I have gotten in the habit personally of, because my mouth, if I don't mouth tape it at night, my mouth will just kind of drop open. And so something like a little piece of silk tape has helped me to just keep my tongue in the right position for sleep, at least.
Right. Yes. So the tongue, I always tell, especially the kids, it's like, I want your swallow pattern to be your built in myofunctional therapy forever.
Mm,
Because if you are swallowing roughly 2,000 times a day, we need it working to our advantage and not working against us
wow.
because there again, form and function and muscle always outweighs the
Hmm.
bone. So if we're hitting it correctly, we're going to be supportive.
Yes.
And that's very, very true for orthodontic
Hmm.
therapy, orthodontic treatment that they've had because your tongue and your lips really are your built in retainers because there are so many times that you can, or you probably know somebody that has relapsed or have
Yeah.
an open bite after
Yeah.
braces. Well, the function most likely wasn't corrected
Mhm.
prior to that. And, just there again, the swallow pattern, but equally the resting posture. So
Yeah.
if the tongue continues to stay low,
Mhm.
that's not supporting the upper jaw
Mm.
and the lips.
Yeah, because it's basically our tongue. I was taught by Dr. Caps, our son's orthodontist that you work with, the tongue's really what's expanding your top jaw, right? The
Exactly.
maxilla. And so it doesn't matter genetics as much. It's up to your tongue to give that maxilla the expansion. Our lower jaw has some genetic component. There's people that just naturally have a bigger lower jaw, but at the same time, when our tongue is up, it helps, is that correct, to bring the jaw out in a good
Yes.
form?
Yes, because if you think about, your tongue is the guide
Mhm,
for forward development and then the lateral expansion.
mhm.
And our teeth, they always want to come together. So when they want that occlusion, they're looking for one another. So if we are expanding and growing and guiding the jaw in an appropriate manner for airway support, then the lower jaw is going to come up too, and it's
Mhm.
going to meet. So if we really had good function and chewing patterns and nasal breathing, we could really offset a lot of the myofunctional disorders and the dental crowding and the need for a lot of orthodontic
Yeah.
treatment later.
I've been joking with my kids recently. We try to get them to eat an apple a day. It doesn't always happen, the whole old saying, "An apple a day keeps the
Yes.
doctor away." But I'm like, I wonder if it's more about the whole apple. Like, is it because of the nutritional value of the apple, or is it like the biting? Is that saying, but I don't know, the more I've looked into this, I'm like, maybe it's not just, the micronutrients and macronutrients that we're taking in, but how we consume it. If it's all smoothies, which smoothie's healthy, but we can't get all our nutrients through a smoothie like in Wally, where they're going around with their like smoothie hamburgers.
Yes. Yes.
It's like we want to
Yes.
do
No,
that.
it's true.
Say that
No,
again.
I think you're right. I think it's all the above because we want them to be able to chew, a good 20 times, maybe 30 times before they're ready to swallow.
Yeah.
But also, if you think about, like you were saying, that the micronutrients in an apple, the all of the polyphenols and the antioxidants in an apple. I think there's like over 400
Wow.
versus if you were to take, an isolated vitamin, you're not getting all
Hmm.
of the synergy with all of those phytonutrients working together. You're getting bits and pieces of that
Yeah.
in a laboratory made. So
Yeah.
I think it's, you know, underrated what an apple can do for you.
Yes. Yes. Do you want to just shift gears a little bit to share a little bit more about your nutritional piece and what you can offer with your, is it called food first approach?
Yes,
Yeah.
yes. Thank you for asking. I realized that so much of what we do as myofunctional therapists is talking about the chewing and the swallowing because that is so important. And when we have a dysfunction with mouth breathing, we also have a disruption with the oral microbiome.
Hmm.
Well, also that nasal microbiome and everything, is one track. So we have the gut microbiome,
Hmm.
and there's so much information now, and people are hearing about all the time
Yeah.
probiotics for your gut. But we also need probiotics for the upper tract
Wow.
too.
Wow. I
And
didn't think about that.
if we have anybody, no matter what age, if you are mouth breathing a lot, maybe you're more susceptible to decay
Hmm.
because of the pH challenges.
Hmm.
Maybe there's a little nocturnal reflux.
Hmm.
And, it's not because you ate a greasy piece of pizza,
Hmm.
it's more of that airway and that vacuum that kind of pulls. And so I actually, when I was in hygiene school, I really, really loved the nutrition piece of that. And I realized just through my own health journey, being a cancer survivor, for a long time now,
Yeah.
I really wanted to support my body with
Yeah.
what I put in and on my body. Anyway, but it just really coincided with what I'm doing here
Mhm.
with no matter if it's a child or an adult, and looking at the body as a whole and looking at the whole timeline from
Yeah.
prenatal history to birth to childhood diseases, all of the things that can be triggers or traumas that we've had that may lead to if we've been diagnosed. So I'm not looking at the diagnosis, I'm looking at the terrain or the soil and trying to support that
Hmm.
so we can use food as medicine to help heal our bodies or to support our healing process. And a lot of the children that I see, they don't like to eat raw fruits and vegetables.
Yeah.
And so that's when I can help guide them to alternative methods to do that, but also helping to support their oral microbiome and their gut microbiome. Because if you have a child that's sick all of the time and they're constantly on antibiotics, we need to constantly rebuild that.
Yeah.
And we need to be supportive. So I've just kind of taken that piece, the nutrition piece, and folded it into what I do. But I also can separate it out, and I do work with clients for functional nutrition that we're not doing anything myofunctional.
Yeah. Yeah. And you even can offer supplements like I took them growing up, Juice Plus, or things where if maybe you're not all the way to the kids eating the raw fruits and veggies, you could have something in a pill or gummy form that could help kind of be a bridge, if you will.
Yes, it just bridges the gap between what we can or don't eat. And the thing about Juice Plus that I love so much is that it's food. It's 100% food. It has over 50 gold standard research studies. So it's not an isolated vitamin. It's very, very thoroughly tested. The research institutions are just amazing, at top of the line institutions that have done their own research. And I've had a lot of breakthroughs with some children that have been on the white diet or very bland diet. And even my own son, we started him, he got to that phase where he wasn't allergic to anything that I know of, but you know, he would hear his friends talk about,
Yeah.
"Oh, I'm allergic to that and I don't want to eat that." And
Yeah.
he only wanted to eat what his friends were eating, and
Mhm.
I'm like, well, so it became a challenge, and you kind of have to pick your battles sometimes. And so I introduced the Children's Health Study where he could get the Juice Plus for free. It's
Mhm.
probably what you did too.
Yeah.
I don't know if you did it when you were younger, um, and I just didn't say anything. Sometimes he would be good about taking them, and sometimes not so good. But over time, the compound effect, I remember the days like, I think I want to take a salad to lunch. I don't
Uh-huh.
care what my friends think. And it just really, when you're giving your body whatever you're giving it, whether it's sugar or whole foods, it's going to crave more
More of that.
of what you're getting. So, and now they have a powder form where it's not necessarily a chewable gummy or a capsule, which most kids can't swallow. But
Yeah.
yeah, it's just been really great to be able to offer that.
Yeah. It's kind of the same principle. I know they've done studies. If a woman eats really nourishing, nutritious foods when she's pregnant, the chances of a child, a baby, like being open to more diverse foods is greater. Or same with if babies get diverse foods when they're a baby, then they're gonna not have as much trouble probably as a toddler because it's like their
Mhm.
palate has experienced, like you're saying, like when you taste authentic foods, you don't like Pop Tarts or something like that. But
Right.
then if all you've grown up on is McDonald's and Pop Tarts, then it's hard to enjoy a fancy Italian, you know, made from scratch meal or something like that.
Right. That's true. Yes. I know. And I don't know, you've probably seen in my office where I have the Happy Meal from
Yes,
2008 still sitting on my shelf. The same, it looks the same as the day I bought it.
that's
It's
crazy.
just, it's crazy, a little petrified, but
It literally
no mold.
can't
Mhm.
go bad. It's that fake.
Right.
Yeah,
Yes.
and that's I feel like a whole nother topic of just food and there's so many. I know we touched on it when we were in person last of just with all these issues there can be a lot of mom guilt. Oh my goodness, the lights are shining, I realize my kid might have a tongue tie, or oh my goodness, we have some oral dysfunction. What kind of encouragement can you give to a mom who's starting to feel overwhelmed? Like, I didn't know that chicken nuggets and French fries for every meal wasn't ideal. What encouragement could you give to us?
Yes. Well, first of all, I want to tell everybody there's no mom guilt because I would be first in line with a big neon sign,
Yes.
mom guilt, because I look back and just think that I only, we did the best we
Yeah.
could with what we knew. Okay. But when you know better, you do better. I mean, I remember early in the dental office cleaning kids' teeth, and I would give them a free, Happy Meal
Yeah.
coupon.
Yeah.
I mean, but there's no mom guilt because, and some mom, I want to meet you where you are, okay? Because maybe that's the only thing that your child is eating is chicken nuggets.
Hmm.
Well, okay, we can start slow. We can make one simple change, and let's find out what works. And maybe it may be different therapies. Maybe a lot of times I may need to kind of say, maybe you need to see this person first and then come back to me.
Yeah.
Or so I don't want anybody to think it's too late for your child. I have adults that are in their 70s that I'm seeing, and it's never too late to breathe better,
Mm.
right?
Yeah.
Or to improve our oral health, are our nutrition,
Yeah.
are our sleep and breathing.
Yeah. And that's, yeah, so encouraging to hear that you even have elderly patients who are like wanting to make improvements in their life. And so it's kind of just like maybe doing the next thing. Like maybe it's buying that chewy tube, like you said, or just being more aware, having that awareness. Do my kids have their tongues down in their mouth? Are they breathing through their nose with their tongue up most of the day? Um, would you, let's see, just want to share as we're closing, just how people can reach you. We'll definitely include it in the show notes as far as people getting scheduled for myofunctional therapy. I know we live in East Texas, and you were kind of like, well, you're like the best, one of the first in Texas, but you were kind of like our only option, and we didn't want to have to drive to Dallas, to do therapy. And so we were so thankful for your help, but maybe even how you could reach women who are more rural or don't have all those options that a big metroplex has.
Absolutely. So I do like to give options because we have we talked about good, better, and best.
Mm-hmm.
And if maybe all you can do is come see me for just a consultation and get a little bit of guidance of
Mm-hmm.
what you can do at home to help.
Yeah.
Maybe your child is a thumb sucker, but you just really can't make the little habit program work. I can
Mm-hmm.
help direct you in things that you can do. Maybe adding on to that would be adding the Myology or a little therapy tool, and then from there is helping you find maybe a pediatric dentist or an orthodontist focused on airway or tongue ties,
Mm-hmm.
one of the specific providers that you need. And allowing you to have the knowledge of what's out there so you're better equipped to make a decision of what you can do and what you can afford and your time. I, am certified through the international, the IAOM. And if you go to the IAOM.com, and we'll put that in the show notes, I know you'll have that in there.
Mm-hmm.
There's a list of all of our therapists,
Okay.
and I just think it's important because being certified just adds another layer because it really took me a good year and a half to become certified because we're doing a written evaluation with all different phases of cases in therapy, and then we are doing an on-site with clinical observation and really learning how to use our critical thinking skills.
Mm-hmm.
So every child that I see is not a cookie cutter approach.
Mm-hmm.
There are basics that everybody needs to know, yes, but I really try to individualize that. So my website is the East Texas Orofacial
Yes.
Myology, and I'm on Instagram and Facebook. Uh, and then just going to the main IAOM website, if
Yeah.
you aren't close,
Mm-hmm.
that can help guide you. And or you can call me and I can help. Maybe if I know somebody in your area, since I've been around for a long time, I know a lot of the
Yes, you're a
therapists,
great
so
resource. Yes.
I can help direct.
Yes.
But yes, I can do teletherapy,
Mm-hmm.
and maybe you live not too far away, but far enough that it's kind of complicated to drive all of the time. Maybe we
Yeah.
just do every now and then in the office.
Mm-hmm.
So, yeah, as long as, the internet is good and, we can, COVID really made that happen.
Yeah.
So
And it
we
feels
got
like,
really good.
with an older kid, it's not as critical. Maybe a 3-year-old would be more challenging on the computer, but more training for the parent to do it with
Yes,
the child. Okay. Yeah.
yes.
And then I don't know, is there anything, thank you so much for your time today, Misty. Anything we haven't talked about or that you would want to just share more about in closing? We're going to
Yes.
include all of your information in the show notes, as well as like I believe a discount code for people who are interested. Yeah.
I don't know. Maybe I got a little sidetracked a while ago, but we were talking about. Did we talk about when I gathered my habit cases and
No,
was
I wanted to talk about that. Yes. Yeah. Could you share
okay?
with us more about the tongue tie
Sure.
research you did? Yes.
Yes. Actually, it was. I gathered a group, well, 300 of my
Wow.
previous non-nutritive sucking habit cases. So pacifiers, thumbs, fingers, all of the things.
Yes.
And I really wanted to know what was the dominating factor driving that. Was it
Mhm.
tongue tie? Was it airway? Because generally, if the tongue isn't in the palate correctly and they're in their mouth breathing, it's usually tongue tie or airway related. So I was really curious and I was doing a presentation, so I wanted to gather that information. And over 88% of those non nutritive sucking cases were airway related. Now, there was a big overlap with airway and tongue tie over, 50%, but just the tongue tie alone, it was still under the airway. The tongue tie alone was about
Wow.
67%.
Wow.
So, you know, airway is a it's a really big issue in our craniofacial jaw growth and development.
Hmm.
So, I think the most supportive thing that mom can do is ensure nasal breathing,
Hmm.
whether you need to see an allergist or take more of a homeopathic or natural remedy. Find
Yeah.
some way that you can mitigate. Maybe it's looking into mold, but don't be overwhelmed,
Yeah.
because I feel like it can be very overwhelming. Mom comes in here thinking their child has one thing, and then we're discussing a whole long list,
Yeah.
and it can be very overwhelming. So, one step at a time,
Yeah.
okay? And if you, as the mom, you're your child's best advocate. And I love the fact that we are in a season, in a culture now that moms are doing the research. I never asked a question.
Just
Uh,
do what the doctor says. That's it. Yeah.
Never. And looking back at that, I can see some gaps. But now moms are really driving that ship. So
Hmm.
if you're dismissed, if you're told they're going to grow out of it, maybe that's because the provider doesn't have the answer,
Hmm.
and the default is they will grow out of it. Um, Maybe it's time to dig a little bit deeper and continue, because if you know your child isn't sleeping well, their mouth breathing, their crowded teeth, they're, the tide is shifting with early orthodontic intervention. I have a lot of kids that are being treated with early orthodontic intervention by great pediatric dentists and orthodontists, in the before the age of 7.
Yeah.
And so I would say just keep researching and don't feel like you're made like, I don't know why I was thinking that, like my doctor just dismissed me. But if you really feel it, something's not right with your child. Just keep asking questions and maybe, not to find the one that you want to hear, but just do a little bit more investigating to make sure that you can find the right provider to help support you, because it's never normal to snore, okay?
Yeah.
And a lot of times that's dismissed,
Hmm.
and we want to make sure that cognitive function and all
Hmm.
of the things are supported. And the other thing, big thing that I have, not that I'm treating it, but is bedwetting.
Yeah.
And oh well, that they'll grow out of it. Well, when
It's
they're
a sad and
12,
mental thing. Yeah.
that really is affecting their social life
Yeah.
and their self-esteem, and no, they're not growing out of it.
Yeah.
So dig a
Yeah.
little bit deeper.
Yeah. I mean, been a lot our story because I had jaw surgery. I had another family member who had jaw surgery. So it's like, I do not want my kids to follow in my tracks in that way. And so with one of my children, we did an early consult for early orthodontics. And the orthodontist, more traditional, just kind of laughed at me. I mean, I brought up some of these words, myofunctional or this or that. And, it's like he had never even heard of it, and so he just, oh, he'll be fine. Just wait till he's 12, and I'm thankful that we had some friends and people like you who I was able to ask some more questions to, not necessarily that he's doing a bad job, but just, okay, I think in my case with my child, we're going to do something differently. And, I feel like it's similar in the medical field, something's kind of frowned upon or people don't care, like smoking in the past or aspartame, and now it's kind of, oh, common knowledge, smoking's not that great for you, or, oh, don't be doing that sweet and low, but for so many years, people would just say, oh, there's no big deal, I mean, that was kind of in the ENT world. We do sleep studies. We try to make sure someone doesn't have sleep apnea. But if they mouth breathe and don't have sleep apnea, it's like, well, I think they're fine. Everything's good, And that's just kind of, the traditional Western approach versus more of a functional medicine. Like, okay, this issue isn't as big as sleep apnea, but there's still something there. Like you're talking about the airway. And it seems like that is becoming just an increasing area of, as a society, we need to like wake up and like look into it, right? For adults and children.
Absolutely. And especially when you're taking your child in for their cleaning, they
Hmm.
should be doing an airway exam,
Wow.
just like we do a cancer screening.
Yeah.
You're looking at the same tissue. You just maybe need to ask a few more questions.
Hmm. Wow.
So, and a lot of people, it's true, professionals, medical dental, they've never heard of myofunctional therapy. So maybe they think, oh, this is just some new fad.
Yeah.
But it actually started in the early 1900s with an orthodontist
Wow.
recognizing form and function, like
Wow.
something's not right here with the tongue and the mouth
Mm.
breathing. So it has been around a very long time. Well, the IAOM has been around. I mean, we've celebrated 50 years
Wow.
of training therapists.
That's amazing.
It's just very
Public awareness.
small
Yeah.
group, but now we have many, many more that are being trained. And hopefully now with the way social media is, there's so much out there now that it's more accessible to learn these things. But yeah, we just still need to keep talking about it and going back. And I always tell my families, it's like, go back and share with your primary care or your pediatrician
Yeah.
and let them know the things that we found because I would
Yeah.
love to have a conversation with them.
Yeah. 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 Again, that bridging the doctors or specialists aren't the enemy and the natural alternative therapists aren't either. It's like we need that bridge of connection. And I know you are doing that so beautifully in your practice. You take care of medically complex children and you're able to really navigate that nuanced care where you're giving that individualized specific approach that is different. It's not just a copy paste. And I really appreciate that about you, Misty, from our own personal
Thank you.
experience. And I hope our audience has enjoyed hearing from you as much as I have. And we will include all of that information so that people can reach out and connect with you coming up. So thank you so
Yes,
much.
and maybe I have a little checklist that I will give you that you can kind of like a awareness checklist for moms to look.
Amazing. Oh, thank you. That's,
Yeah.
yeah, having something quick to look at is a big help.
Yes.
So, yeah.
Well, I'm honored that you had me on your show. I appreciate that.
Yeah,
It's
thank
always
you.
a pleasure.
Oh, thank you so much, Misty. Well, have a great rest of your day today.
Same to you. Bye.
Bye. This is not medical advice and is for general, educational, and informational purposes only and should not be used as a substitute for professional medical advice, diagnosis, or treatment. Listeners are advised to always consult with a qualified healthcare provider regarding any medical condition or treatment plan. This information is for personal use only. Rather than asking you to comment or subscribe, we want to encourage you to share our channel with others if you found this helpful. We are committed to nurturing face-to-face relationships and encourage you to be known and seen by those in your world.